Today about ovulation and fertilization. Question number 34. Which of the following is the common site of fertilization? Option A. Ampulla of fallopian tube. Option B. Infundibulum. Option C. Stomach. And option D. Interstitial. Correct option A. Question number 35. Fertilization of ovum in female takes place in option A. Vagina, option B. Oviduct, option C. Uterus, and option D. Cervix. Fertilization of ovum in a female takes place in oviduct, ampulla part मा हुन्छ. Question number 36. Fertilization of two ova released in different menstruation cycle is known as option A. Superfetation, option B. Superfecundation, option C. Fetus papiresis, and option D. None of the above. Fertilization of two ova released in different menstruation cycle is known as a superfetation. Option A is right answer. ध्यान लगाएर सुन्नु होला. टु डिफ्रेन्ट मेन्स्ट्रुएसन पिरियडमा फर्टिलाइजेसन भएको छ भने त्यो कन्डिसनलाई सुपरफेटेसन भन्छ र सेम मेन्स्ट्रुएसन पिरियडमा यदि फर्टिलाइजेसन भएको छ भने त्यसलाई सुपरफेकाउन्डेसन भन्छ. क्वेशन नम्बर 37. The process of fusion of the spermatozoon with the mature ovum is called option A. Ovulation, option B. Gametogenesis, option C. Fertilization, option D. Implantation. The process of fusion of spermatozoon with the mature ovum is known as option C. Fertilization. Question number 38. Ovulation is defined as option A. Maturation of Graafian follicle, option B. Rupture of Graafian follicle, option C. Seepage of blood through vagina, and option D. Facilitate their maturation during embryonic development. Rupture of Graafian follicle, option B. Ovulation is the process of releasing oocyte due to rupture of Graafian follicle from ovary for conception. It occurs 14 days prior to expected next period. So it is the best time for conception. Question number 39. Ovulation occurs option A. 14 days before next menstruation, option B. 1 week after menstruation, option C. 1 week before menstruation, and option D. 28 days after menstruation. Ovulation takes place in 14 days before next menstruation. Option A. Question number 40. When is the best time to achieve pregnancy? Option A. Midway between 7 to 8 days of ovulation. Option B. Immediately after starting of menses. Option C. 14 days after the beginning of the next period. And option D. 14 days before the next period is expected. Ovulation कुन टाइममा हुन्छ? 14 days before the next period is expected. Option D is right answer. Question number 41. In 28 days human ovarian cycle, ovulation occur on option A. Day 14, option B. Day 28, option C. Day 5, and option D. Day 1. सेमै क्वेशन छ, डिफरेन्ट तरिकाले चाहिँ सोधेको छ. Days 14, option A is right answer. Question number 42. After ovulation has occurred, the ovum remains viable for option A. 1 to 6 hours, option B. 12 to 24 hours, option C. 24 to 36 hours, and option D. 48 to 72 hours. Option B is right answer. After ovulation, the ovum remains viable for 12 to 24 hours and a sperm for 48 to 72 hours into female genital tract. Question number 43. The term Mittelschmerz refers to option A. Varying degree of abdominal pain during ovulation, option B. Pelvic girdle pain during pregnancy, Option C, lower abdominal cramp during menstruation, and option D, intermittent uterine contraction during labor. Mittelschmerz means varying degree of abdominal pain during ovulation. Option is right answer. यो क्वेसन धेरै इम्पोर्टेन्ट छ र धेरै स्टुडेन्टहरूलाई चाहिँ कन्फ्युजन हुन्छ यसमा. Mittelschmerz means mid pain is an abdominal pain midway between menstruation periods occurring at the time of ovulation and from the ovulation site. It occurs due to peritoneal irritation caused by fluid and blood release from ruptured follicles. Question number 44. The phenomenon of Mittelschmerz indicate option A, implantation, option B, menstruation, option C, ovulation, and option D, fertilization. Mittelschmerz means कतिखेर हुन्छ त pain during ovulation. So it indicate ovulation. Option C. Question number 45. Flattening abdominal pain due to follicular bleeding causing peritoneal irritation is called. Option A, corpus hemorrhagicum, option B, Mittelschmerz, option C, corpus luteum, and option D, corpus albicans. Option B is right answer. Question number 46. In a lecture or sexual functioning, the nurse plans to include the fact that ovulation occur when the option A, oxytocin level is high, option B, blood level of LH is high, option C, progesterone level is high, option D, endometrial wall is slowed up. Blood level of LH is high. Option B is right handed. It indicates ovulations. LH is essential for ovulation. LH भनेको luteinizing hormone. Luteinizing hormone causes rupture of a mature follicle and expel the mature ovum from follicle, which called ovulation. Ovulation occurs about 24 hours after luteinizing hormone surge. Question number 48. Luteinizing hormone surge occur. Option A, 24 hours after ovulation. Option B, during ovulation. Option C, 24 hours before ovulation. And option D, 4 days after ovulation. यसले भर्खर भने ovulation occur between 24 hours after the LH. So option C is right answer. Question number 48. During the ovulation phase of menstruation cycle, ovulation is caused by secretion of option A, estrogen, option B, progesterone, option C, luteinizing hormone, and option D, follicle stimulating hormone. Luteinizing hormone, option C. Question number 49. Drug of choice for induction of ovulation is option A, clomiphene, option B, ethinyl estradiol, option C, danazol, and option D, levonorgestrel. Clomiphene. Option A is right answer. Clomiphene citrate is a non-steroid agent used to stimulate ovulation in women. Women treated with these medicines who become pregnant have an increased incidence of multiple pregnancy. Question number 50. A female patient डाइट मिन्स के भयो त इन्डक्सन अफ ओभुलेसन गराउनको लागि क्लोमिफेन युज गर्छ. यसको कम्प्लिकेसनमा के हुन सक्छ कि इन्डिकेसनको लागि क्लोमिफेन युज गर्छ भने इन्डिकेसनमा के हुन सक्छ, मल्टिपल प्रेग्नेन्सी हुन सक्छ. क्वेशन नम्बर 50. A female patient getting clomiphene citrate therapy during pregnancy, the risk of which complication may increase? Option A, ectopic pregnancy. Option B, multiple pregnancy. Option C, polyhydramnios, and option D, missed abortion. कुन हुन्छ? Multiple pregnancy. Option B. Question number 51. Spin barkate appearance of cervical mucus is a sign of option A, menstruation, option B, pregnancy, option C, menarche, and option D, ovulation. Ovulation. Splint workup means evaluation of the elasticity of cervical mucus used to determine time of ovulation. On the day of ovulation, elasticity of cervical mucus is good, measuring 12 to 24 cm or more. Question number 52. Font test is used to assess option A ovulation, pregnancy, cervical cancer and menstruation. के को लागि यूज गर्छ होला फन्ट टेस्ट यूज फर ओभुलेसन ऑप्शन A is right answer. Font test or cervical mucus used to assess the following like a smear of cervical mucus may be helpful in determining when a woman has ovulated, and it is also used to confirm the rupture of membranes by microscopic examinations of samples of dried vaginal fluid at a time. Next about menstruations, ovarian cycle in next videos. Thank you so much.